to start discussing one of our new tracks that we're about to introduce. As you all know, you've been admitted to an academic department. And as part of those departments, you have the option of pursuing some concentrations and some tracks. And the newest one that we're really excited to introduce is the maternal and child health track. And so joining us for this session is Rafael Perez Escamilla, one of our beloved faculty in social and behavioral sciences, a favorite among students and staff, always so generous of his time and expertise. He is in addition to being a faculty, he is also the director of our global health concentration. So that may be of interest to some of you as well, and our public health practice. He is a specialist in maternal and child and infant nutrition, the health disparities, among others. So I'm going to hand it over to Rafael to allow him to discuss this and open this up to any questions that you may have. And so thank you, Rafael. It's all yours.
Thank you very much, Mary. And I wanted to kindly ask my colleague Amber Romy Fiedler,
thank you,
who will be co-presenting with me, if she can please share the slides.
Sure. Would it be all right for me to have permission?
So I think Amber needs to be made a co-host.
Mm-hmm.
I just did that, Amber.
Okay, wonderful. Thank you.
Welcome.
Okay. Is this?
Yeah, and good afternoon, everyone, and welcome to the Yale School of Public Health. Again, for some of you who may have been at my session on the global health concentration yesterday. As Mary mentioned, we are very excited about the fact that we have just gotten approval for our brand new maternal and child health promotion track, which in many ways is a response to popular demand from students and faculty members across departments. So Amber, if we can go to the next, please. So the executive committee or leadership team for the maternal child health promotion is formed by myself, who will be directing the track, my colleague, Professor Donna Spiegelman, who is the director, and I should say founding director of CMIPS, or the Center for Methods in Implementation and Prevention Science, and our wonderful coordinator will be Dr. Amber Romy Fiedler, who is an associate research scientist in the school with a couple of decades of experience doing domestic and international work in the area of maternal child health, specifically also in interventions and programs related to the promotion of the work in this field. So if we can go to the next, please. So why did we decide at the Yale School of Public Health that it was time to actually develop and launch such a track? First of all, because we know it is very well established through hundreds, if not thousands of studies, that the first 1,000 days of life, that is gestation or pregnancy, plus the first 2 years of life or so, are a very critical window of opportunity for promoting infant growth and development. Secondly, promoting optimal nutrition, health, and care through the implementation of high-quality evidence-based interventions during this time has an immense potential to improve short-term, medium-term, and long-term maternal, infant, and child outcomes. And we know that this in turn translates into healthier families, healthier societies, and at the end of the day, improved national development and improved environmental sustainability and planetary health. So really, the first 1,000 days of life in many ways are the foundation for the ability of nations and of the world to reach and meet the 2030 UN Sustainable Development Goals. The implementation flavor that we are giving to the track is very unique, not only in the US, but globally, because we think that the science in the field of implementation has advanced a lot, and that we now have access to very powerful methods to understand not only how to deliver interventions on a large scale, but also how to do that with quality through innovative approaches. So at the end of the day, a very important focus of this track is to bridge the gap between what happens during the process of translating the evidence from small-scale evidence-based interventions into the implementation of very cost-effective, large-scale maternal child health promotion programs that take equity and social justice considerations into account. Next, please. So the specific aim of the what we affectionately call the MCHP track is actually to provide those of you who choose to do it training in maternal and child health in a systematic way that emphasizes the application of implementation science principles in delivering evidence-based interventions and programs. And we know that the earlier we start in life, the more can be done about preventing adverse outcomes and fostering health and child development. So that's why a number of faculty members in the school, that's a period of time that they're focusing on. The track takes a multidisciplinary approach to implementing evidence-based practices to improve maternal child health outcomes. And again, you know, the idea is to provide each and all of you who want to follow this track with world-class implementation science training to really be well-positioned to get a wonderful job if you want to work in the area of maternal child health promotion when you graduate. Next, please. So with regards to the competencies that we want to make sure all the track completers end up having is for each of the students to master the core curriculum competencies. And it is important that at the end of the day, each of the students completing the track is able to understand implementation science theory and frameworks and how they apply to MCH promotion programs, to have knowledge on the range of evidence-based interventions currently available, which are many that we know are efficacious, but we have not learned well how to make them work in an effective way under real world circumstances on a large scale. And to understand which are the strengths, weaknesses, and contexts under which these interventions can operate. Then to be able to propose sustainable evidence-based solutions to address MCH challenges. And once we go for real-world programs, how do we evaluate and assess the quality and fidelity with which these MCH promotion programs are being implemented? And apply knowledge and skills learned in the classroom to an applied MCH promotion project, as Amber will explain in a moment. So Amber, over to you to please take us through the requirements for the newly minted MCH promotion track.
Thank you so much, Rafael. So there are requirements to be able to complete the MCH promotion track. And that consists of 3 courses within YSPH. They are specific courses that and I will share them with you, which ones they are in the upcoming slides. these courses are in addition to the required coursework for your respective departments. We also require, through the School of Public Health, students do take internships and applied practical experience and we are encouraging that focus to, strongly encouraging that focus to be in maternal child health promotion. We also require that a thesis, it is encouraged to be, if that is applicable through your department, we really strongly encourage that it be on a maternal child health promotion issue. And for both the internship as well as the applied practice experience and the thesis, both Dr. Perez-Escamilla and Dr. Spiegelman will help with guiding that particular promotion experience to, so it's something that you will communicate with us about, so that we can know very well that it's an MCH promotion. And then we also do have courses that we do recommend. They are not required courses, but they are courses that we feel would really help to strengthen the training in maternal child health promotion, and that you could take as electives. There are 3 required courses, as I mentioned, and these are the required courses. The first course is the Health of Women and Children. That's offered by Dr. Mary Alice Lee, and that is offered in the spring each year. There are 2 fall courses that we also require, and the first is Implementation Science, and that's taught by Dr. Luke Davis. And there's also Maternal Child Public Health Nutrition, and that's taught by Dr. Perez-Escamilla. These 3 courses will give you the opportunity to look at, to understand maternal child health promotion in the context of implementation science principles. These are the additional recommended courses for those who would like additional training in maternal child health promotion. They consist of different courses in biostatistics, chronic disease epidemiology, social and behavioral sciences, and these courses have been thoughtfully recommended with the understanding that in a maternal child health promotion track, it's very important to help build the methodological understanding. And so we have thought about these courses as being those that could be additional courses to take as electives if you'd like more training. The internship and the applied practice experience are both required for an MPH. And the applied practice experience can be met through an internship or a practicum course. We really strongly encourage a maternal child health promotion focus. And as I mentioned, I am the coordinator and will be happy to help as you develop your internship and practicum course to discuss about the fact of whether it's a maternal child health promotion focus, and Dr. Perez-Escamilla and Dr. Spiegelman will also be able to help with that focus, or at least to guide as to whether that's a focus. The Office of Public Health Practice and the Career Management Center, they both provide guidance on requirements, and they can assist very, very well with the placements. So if you would like to register for the maternal child health track, what you would do is send a letter of intent to take this track to me, and I will be in touch with you during the coursework to serve as a resource for information about the track, to answer questions that you may have along the way, and to serve just to guide you with your coursework as needed. you can, after completing the requirements, your track will be reflected in your transcript under your major. So it will actually be visible on your transcript that you did complete all of the requirements for this track. Now, I realize that you may have many questions about the track, and you are welcome to contact me with questions about the track, with your intent, and I will be very happy to answer those questions, as well as to talk with you further if you'd like to talk one-on-one as well.
Thank you so very much, Amber, for a very clear presentation and for your real hard work and dedication to make this dream really happen for the school. I was hoping for Dr. Spiegelman to address you as well, but I am not sure if she has been able to join the presentation. But in the meantime, I also wanted to emphasize one very cool feature of the way we planned the maternal child health track. If any of you is interested in doing both a global health concentration and this track, essentially the required courses for the maternal child health promotion track can be counted as the elective courses for the global health concentration. So that is something that I want all of you to think about, because for many of you it would really make sense to do both, and it wouldn't really require any more additional work. So we want to open the floor for any questions that you may have. And feel free to speak or to write them in the chat as you feel more comfortable. So Amber, Pooja is asking, when do we have to submit our letter of intent by?
You know, I'm so glad that you asked that, because that was actually something I realized that I wanted to let everybody know. We would like to have your letter of intent by the spring of your first year. So it is something that you can think about through the fall and into the spring. We would like to be able to know by that time so that we could, provide guidance for you about the track.
I think,
sorry, please go ahead.
I think Dara Gleason might have had her hand raised for a question. I don't know, maybe it was answered in the last one. But if Dara, if you're on and you want to go ahead, please do.
Hi, Mary. Yes, I actually did have two questions, and one was Pooja's question, so that was great. Thank you. My other question is it possible to have a track and a concentration? So, for example, registering for the maternal child health promotion track and then also having like the health and justice concentration. Is that allowed, or how does that work? Thank you.
Yes, and yes, very, very much so. And we encourage that. And we think that the social justice concentration is a perfect concentration to do as well, in combination with the MCH promotion track. So I think that we also have the modeling concentration, which also lends itself very nicely for wonderful training for those of you who want to focus on maternal child health promotion. So at the end of the day, it is our job to hear back from you if for any reason you're trying to do a concentration on the track, and for scheduling reasons, for logistical reasons, it is complicated. It is our job, those of us coordinating these concentrations and tracks, to also coordinate with each other to make sure that we remove any hurdles or bottlenecks as you may encounter. We want each and all of you to to get the best experience while we have the honor of having you with us in the program. So Amber, there is one question. Is there a way we can see the MCH course descriptions? Are they available online?
Yes, so they are available online. If you go to the YSPH course course link, then there are descriptions of them. What I'll be happy to do is, while other questions are being asked, I'll quickly go through and see if I can get that link for everybody so that they could view the courses.
Mm-hmm. And then there is a very good question about the difference between a track and a concentration. So they are not interchangeable terms. Usually the goal of a track is to eventually grow up as it matures and become a concentration. The concentrations typically have perhaps a little bit more requirements. There is also a direct oversight from CIF, from the accreditation, the organization that does the accreditation of schools of public health of the concentrations. So in the concentrations, we have to demonstrate as instructors that we are assessing in an acceptable way every single competency that we are listing as being offered to you through the concentration. With the track, it is not overseen by CIF, so there is a little bit less, so to speak, bureaucracy involved. We have more flexibility on how we want to shape the tracks. So that's I would say one of the biggest differences. So for example, many concentrations have a capstone course. It is required because there has to be a guarantee that every single person that does the concentration gets exposed to every single competency that is being listed under the concentration. With tracks, usually there isn't a requirement for a capstone course, and there isn't a requirement to demonstrate that every single student will be exposed to exactly the same activities to document that they have met the competencies. So those are two important differences there.
So I just wanted to let everybody know I do have the link for the Yale courses. What I would be happy to do is this link will provide everybody with the ability to see all the YSPH courses, and this will also allow you to see those 3 courses. But what I will also be happy to do is to put a description of each of those courses together if there may be a way that we could get it to the group, if there's a way of being able to just allow them to see those 3 descriptions.
Mm-hmm. Yeah, and there is a follow-up question to the response I just gave. So Divya, I'm sorry, I cannot see anymore, but you're asking if there would be if there are consequences to the quality of the course delivery and experiential value for students if CIF doesn't oversee the tracks, and the answer is absolutely not. Essentially, that responsibility for the track to be up to par with the very high quality, the world-class quality of what we do at the Yale School of Public Health is the responsibility of the Yale School of Public Health. It simply means that we have a little bit more flexibility in terms of how we shape initially the track, in terms of making adjustments along the way as they are needed. and also in terms of our ability to perhaps tailor it more to the individual interest of students. That's really all that it means. At the end of the day, developing this track took us at least 3 years of consultations, of thinking, of really good interactions with the leadership team of which I am a part of at the Yale School of Public Health. And essentially, it was deemed to be of such need and of such quality what was being proposed that it ended up being unanimously approved by the YSPH Education Committee, which is the same one that approves the concentrations and any new course that we offer in the school. So the school is responsible for your educational experience, and the accreditation body is really more, an oversight, regulatory, and in some ways very bureaucratic a process that the schools have to follow for a good reason. And we do want eventually for the track to become a concentration, but it's not a good idea to start directly as a concentration without experimenting first how it is serving the needs of the students.
Rafael, there's a question about would there be any support for students to become IBCLCs?
Oh, I wish there were. I've been a breastfeeding researcher for over 30 years now. I happen to think that the IBCLCs are truly, truly remarkable and amazing, and have really led the way overseeing the most important breastfeeding protection, promotion, and support programs in the US and many other high-income countries. IBCLC stands for Internationally Board Certified Lactation Consultant. So unfortunately, we do not have like an MPH IBCLC type of program or a formal relationship with an International Lactation Consultant Association, otherwise known as ILCA. But this is a phenomenal suggestion that we should explore. Like, if we have enough interest on it, if we have more students who really would like to pursue, the MPH together with the MCHP track and become lactation consultants, is there a way that, for example, you could gain the required hours of experience to become an IBCLC through your MCHP project? Why not, right, Amber? I think that would definitely be possible.
So we have another question of, could you please share examples of the possible internship opportunities for this track?
Sure. So we have students every year that do internships. Of course, this past year has been very unusual and they had to be remote, but with the World Health Organization, with UNICEF, with Save the Children, with the International Food Policy Research Institute, some of them with the Gates Foundation, so that have really, really engaged in very high-level policy development type of projects related to either maternal health, reproductive health issues related to infant and toddlers and young children's health and development. And we also have students that have done very productive internships with universities or research institutions in many countries all over the world. And this happens to be my field of work. So almost all of them who do these internships, they end up doing those in MCHP. Amber, for example, has a very nice project going on in Ghana. If you want to describe it for us briefly, Amber, for them to see the types of field project opportunities that once a pandemic is over, could be developed through your project in Ghana.
Sure. So we are currently working on a project in a region in Ghana where we are trying to understand, we're first trying to understand the barriers and facilitators to exclusive breastfeeding and complementary feeding suboptimal practices. And we are doing that through in-depth interviews and with both healthcare providers and caregivers to understand the depth of those barriers and facilitators and what may be solutions to that. And then what we're going to do is to implement an intervention that will address those barriers and facilitators using the healthcare providers and enhancing the training that they are given and extending that training and then extending that education with the healthcare providers to home visits. And we have had opportunities, for students in the past where they have been able to work with our sites that are there, our site that's there, to be able to get some hands-on experience with qualitative data, with quantitative data. And this particular project is really moving to strengthen the training and education delivery system in Ghana.
Yeah, and another example I can give you of one of my first students when I moved to YSPH in 2009. She actually did her project on understanding barriers to timely prenatal care in Rwanda. And, her findings have been used to advance a policy related to antenatal care in the country. And we also have a wonderful faculty member. They're all wonderful, but she's especially wonderful, Nikki Holly, who runs a big project in Samoa that actually recruits moms since pregnancy, and then they follow them during pregnancy. They follow the kids, and they're looking at the early risk factors for childhood obesity. So we have numerous examples. We will be posting them also in the website as time permits, so that you can start seeing actually examples, reports, even papers that have come up from those. But for those of you who don't want to do research, that you just want the frontline experience during an internship, you can do it. Actually, I would say that maybe 80% or 85% of all the internship projects in the school end up being experiential learning. They may include like operations, research, implementation type of research, quality assurance stuff, but very the minority are really the research studies, primary data collection to do the thesis projects. If there is something we have an excess of in the school are data sets. So don't lose your sleep over not collecting your data through a summer internship. You will always have access to very, very good data through faculty in the school, almost in any public health topic that you want. And by the way, we do have good representation in the field of maternal and child health across departments, social and behavioral sciences, chronic disease epidemiology, EMD, microbial diseases, EHS, environmental health sciences, and with Dr. Spiegelman playing a leadership role in the track. She also has a very strong presence in the Department of Biostatistics. So we think it's going to be really cool to also see how across the board students can find a common cause and opportunities with maternal child health promotion, which is the track is one of the initiatives. We're preparing to launch more as time goes by and have, either journal clubs or, a practice scholar type of consultation seminar series, so that we actually help you establish a network among those of you that are interested in this topic while you do your studies at YSPH. Did I answer the question about the internship, whether it has to be research only or not? Good. So I wanted to ask you if any of you want to share, any of you who has worked in the field of maternal child health, if you want to share with us what you have done, that would be amazing for Amber and I to hear about.
So I did some work in China. I started this nonprofit promoting access to breastfeeding for Chinese women. And we did a lot of work to also provide maternal health information for, we started with urban women, and then we also brought our volunteers to rural area in China. And we also did some emergency aid after, because I'm from Sichuan, China, and my area had a lot of, not a lot, but sometimes we have earthquakes. So we brought our volunteers to rural areas to basically educate the women there after the earthquake and telling them, your baby is fuzzy right now and it's okay. You don't have to rush to the donated formula and stuff like that.
Yeah.
And we also moved from breastfeeding back to birth practice. And we trained a lot of doulas, and we helped a lot of private, not a lot, but some private hospitals to change their birth protocols to support breastfeeding initiation.
Yeah, that is amazing, Yushi. And in fact, last year, the student that won the Best Global Health Thesis Award is a colleague of you from China, Shannon Han. And what Shannon did was to actually analyze the content of marketing by infant formula companies in China in the biggest two e-commerce platforms. And the findings are incredible. And she's submitting it for publication, hopefully this week. No, but very much related to the work you do. And also, we now have a collaboration in Wuhan and other areas in China on a prospective project looking at the same topic as Amber is, responsive feeding, and how can those interventions work in the context of the diverse cultures in China. So you start seeing right away, how globalized the world is and how we really have a lot of knowledge on risk factors and interventions on a small scale, and the very important next iteration for all of us is how do we take that to the benefit of humankind on a large scale. And by the way, we had an interview, Amber and I, as we were preparing this track for you guys, with the leader for maternal child health at the Gates Foundation. And we asked her 3 questions about what are the skills that she would expect our students to graduate with for them to be attractive, for employment with the Gates Foundation. And, of course, she did mention, critical thinking, but especially ability to connect the dots across the life course as to how, one phase of the life course influences the next one and the next one and the next one, and how really whole of society approaches are needed, to address problems related to maternal child health and malnutrition globally. And, and very interestingly, and she mentioned, and we really want for your students to be able to be very articulate in how they can communicate in very effective and simple terms the work that they do and why they are doing it, and hopefully explain how they were able to engage in team problem-solving exercises during their training. And before we ended the conversation, she said, and perhaps one of the biggest skills that we want for the students to have is to understand how to address inequities and social justice since the conception of projects. So, so that was very reassuring because that's kind of the way we were thinking. That's how we're trying to design now all of our courses at the Yale School of Public Health. So in that sense, I think it's also a very interesting time to launch this track.
Right, I'm super excited about that. And I was super excited about your project in Brazil, because I see a lot of similarities in both China and Brazil. So I was like, yeah, can I join you, please?
Yeah. So we had two students, actually 3 students doing. They were going to the field work. The pandemic hit, so it had to be done remote. But they are actually looking at issues related to how to improve the Crianza Feliz, the early childhood development program, which is the largest parenting skills home-based program in the world for adolescent and young women in Brazil. So, you know, they had access to all the data. They couldn't go and see by themselves, unfortunately, because of the pandemic. But that's another example of how almost any country that you mentioned, we can give you examples of someone that has done an exciting MCH. And yes, you can, of course, join my lab group if you want, Yushi. Okay. So any other experiences that anyone wants to share on maternal child health? Okay, so Dara, do you want to speak up so that everybody hears?
Sure, I didn't want to interrupt before, so I thought I'd just send it in the chat. But I've had a couple of different experiences, as I mentioned in the chat. I was an intern with Nurse Family Partnership, which provides home health aides for first-time mothers of low socioeconomic status. I also worked at my local health department with the early intervention program to provide services to children that needed them. I also currently serve as a youth health educator in Baltimore, Maryland. So I teach elementary school students about nutrition and different health topics. And I've also done research on safe sleep techniques and physical activity implementation programs in elementary schools. So I'm very excited and happy to learn that this is a new track, because maternal child health has been my passion for so long. So I'm very excited about it.
That's great. So we also have a very strong link with a wonderful program at a wonderful organization which is called the Hispanic Health Council in Hartford. And it's a huge SNAP ED program that serves, you know, Latinos, but any children really who are in Hartford Public Schools from preschool to 4th grade. And it's totally a child nutrition education, obesity prevention program. And that program also includes breastfeeding counseling, breastfeeding peer counseling program that is being scaled up through Trinity Health of New England as we speak. So also in the US, we have very deep connections with WIC. We have very deep connections with SNAP ED programs, and I think those of you who have more of a domestic interest, we do have very, very exciting programs led by Kathleen Dufani and Alicia Santilli in New Haven that, you know, can be tailored very nicely to MCH. Actually, they are coordinating the new New Haven Breastfeeding Coalition that is led by Amelia Reese, who is a former graduate from our program. So we have those links as well already in place. Those of you who are interested in refugee health related to mothers, infants, young children, and their families, we do have a very important refugee resettlement agency in New Haven that's called IRIS. That a number of faculty work almost on a daily basis with them. So I think you will not. What we're trying to tell you is to give you reassurances that none of you would go without having a really nice opportunity to practice what you're learning through through your internships in the area of maternal child health promotion or any area that you choose to. We have a really wonderful internship program in the school.
I guess I can speak a little bit on what my experience is like. I'm from Rhode Island, and I come at this work from a grassroots organizer perspective, but also I have training as a registered nurse. And what was happening in the communities in Rhode Island was women, especially Black women and women of color, were not receiving quality health care in terms of of how folks are addressing racism and public health right now. And a young woman named LaShonda Hazard had passed in the care of our main hospital that birthed 80% of our state's children. And we really had to go through a process of community accountability to hold the hospital accountable to change their policies, both institutionally, but also, how also pushing them as nurses and as nursing institution schools who train nurses to come out to have practices that are more inclusive of anti-racism, practices, policies, and to help create an action plan for that hospital to, hey, are you actually looking at in the state and understanding what cultures that are exist here, and do you know different cultural practices? How are you handling this? Because LaShonda Hazard had passed in the ER from neglect and from failure of the system. She lost her baby and her life, and so when you talk about maternal health, we walk with a deep commitment to understanding the most marginalized communities and the most oppressed communities. And this work has really transformed into policy work at the state level to advocate doulas, mainly advocating for perinatal services as part of low-income communities, receiving quality health care. And so I think that has been a transformative space for me. And I wonder, what kind of connections you have in more community-led spaces for maternal child health.
Yeah, so we have many. In fact, in New Haven, OPHP, the Office of Public Health Practice, has become a hub for public health practice projects funded by the CDC and others. So we have a prevention research center. We're part of a consortium that involves a REACH grant that came to Southern Connecticut State University that is very much related right now to overcoming vaccine barriers, COVID vaccine barriers for communities of color. And we know there is a PCORI funded project, and there is CARE, the Alliance, Connecticut Alliance for Research and Engagement, and all of them, plus the Office of Public Health Practice, have very, very deep connections with the community. The models that we're working with are very much driven by community health workers. So if you have an interest in, promotoras de salud, in peer counselors, and in actually understanding, for example, the experiences of structural racism and discrimination on a daily basis by, say, African-American women, given that it is very likely they explain, at least in part, their excessive mortality rate. We have lots and lots of spaces for you to practice very high quality projects. The Yale New Haven Hospital, the School of Medicine, is also very, very committed now. As you know, the top advisor for health inequities for President Biden is Dr. Marcela Nunez, who is a very good colleague of us and with whom we have collaborated for a very long time. So, you know, it is one of the benefits also that the Yale School of Public Health is very connected with the Yale School of Medicine for someone like you, because we are on the same page. And so is the Yale School of Nursing. And what you are describing, for example, I would advise you to consider, you know, for example, doing the social justice concentration combined with the MCH promotion track, because it's very aligned what you are describing with the very high quality training you could get from those two combined. And you could, of course, have others learn from you because you already have a lot of experience doing this type of work. And you mentioned the work policy. At the end of the day, we want to see all of our work ending up either impacting policy or becoming policies in and by itself, effective policies.
Thank you so much.
Thank you. So perhaps we have time for one more comment. We're learning so much already.
If there is time, I just wanted to share a little bit from the mental health perspective. So here in the state I'm in right now in New Hampshire, we just recently finalized a 10-year mental health plan at the state level. And so from a volunteer basis, I did a lot of the advocacy for thinking about mental health from a maternal and young child perspective. I've also attended at Mass General Hospital in Boston. They have some really great programming about resiliency skill building for parents, but I think it's not promoted well enough. I think a lot of time parents are getting these resources really late in the game. So I'm really passionate about like the preconception or prospective parents at that stage, how they could build resiliency skills, how they can understand, possible prevention for mental illness and the factors that might, cause, like, for example, a psychosis episode postpartum, and what kind of care they can get if that happens.
Yes. So also I would encourage you to take a look at the Yale Child Study Center website. And Professor Linda Mays is the director of that center. She's super responsive if you have any questions, because they're very, very good friends of us. The Yale School of Public Health and them, we collaborate in many projects. We're very interested in aligning more our skills and resources to actually go for more interdisciplinary projects where we can incorporate us in the Yale School of Public Health much more the mental health aspects related to women and young children. YSPH is already very strong with mental health aspects among older populations and adults, but the Yale Child Study Center has in place the mental health aspects for moms, infants, and young children that we're building, but we're not there yet within the Yale School of Public Health. But we work very well. That's a beauty of Yale. For those of you that want a more cozy, smaller type of environment with really, really good access to the faculty and so on, it's a university where it's very easy to work across schools as well. It's not like a monster of an institution where it takes you 5 years to figure out who's doing what and so on. So as I like to say, we don't have every single thing, but what we have, which is a lot, we do it with world-class quality. No, and that's what I love. You can tailor each of you, the examples you gave me. That's precisely why the tracks have senior faculty at the helm, because we want to work with the students designing, shaping up their projects, their experiences, and at the end of the day, that they end up, making good professional decisions as well by the time they graduate. So not everybody is going to be interested in maternal child health, but regardless of what area you're interested in, you will find a track, you will find a concentration, you will find something very, very interesting in the school. But thank you. I mean, I think that all of those are wonderful contributions. So Amber, any last words of wisdom?
I think everybody covered it all, and it was a wonderful discussion and conversation. I just want to let everybody know again that I am available. So if you do have questions that come up after this meeting, please just reach out to me. I'll be happy to answer them. And you can see me as a resource about the MCH promotion track.
Thank you both, Amber and Raphael. This has been wonderful. Very informative for me as well. This is, as you all know, a new track that's being rolled out. We're very excited about it here, and I'm glad that all of our guests today are as well. You two are a wonderful resource, and your expertise will be well taken advantage of in the days ahead. So thank you. I also hope any of you that have questions regarding any other programming or admissions or anything else that's concerning you, that you'll feel free to reach out to me and the team at Student Affairs. We are going to continue with our open house events, as you know, from now through April 1st. And these are all being recorded, so hopefully we're going to get them up as quickly as we can. And so stay well, stay in touch with us all, and good luck as you make this very important decision. Again, thank you, Raphael and Amber. It's been great.
Thank you, everyone.
Thank you so much. Thank you. Bye-bye.
Bye.